Have you ever felt a sudden tightness in your chest after a big meal? Or woken up in the middle of the night with your heart racing for no reason? Hi, friends. I'm Dr. Alan Carter, and after 35 years of performing open heart surgeries, I'm here today to beg you, yes, beg you, to stop one common habit that's putting seniors like you in my operating room. And I promise you, it's not what you think. Now, I know what you're imagining. He's going to lecture me about bacon or tell me to run marathons. But no, this habit is something far more insidious. It's something most of us do without a second thought. In fact, you might be doing it right now as you watch this video. And if you don't stop, it could quietly damage your arteries, strain your heart, and steal years of your life. But here's the good news. Fixing it is simpler than you think. No pills, no drastic diets, just a small shift in your daily routine. Today, I'll share exactly what this habit is, why it's so dangerous, and how to replace it with something that'll leave you feeling stronger and more alive. Let's start with the biggest offender I see in my patients. The habit, prolonged sitting. Your heart's worst enemy. Picture this. You wake up, have breakfast in your favorite chair, read the paper, watch a little TV, and before you know it, hours have passed without you moving more than a few steps. Sound familiar? My patient Margaret, 74, lived this way for years. "I'm just resting," she'd say. But by the time she came to me with chest pain, her arteries were so clogged, we had to perform a triple bypass. Here's the hard truth. Sitting for long stretches is as dangerous to your heart as smoking. When you sit, your muscles stop pumping blood efficiently, your circulation slows, and fatty acids build up in your arteries. Over time, this leads to stiffness in your blood vessels, like trying to drink a thick milkshake through a narrow straw. Your heart has to work overtime just to keep up. The fix: micro movements, every 30 minutes. Now, before you panic and toss out your recliner, hear this. You don't need to run laps or buy a treadmill. The solution is as simple as standing up every 30 minutes. My friend Ed, 68, sets a gentle chime on his phone. When it rings, he walks to his kitchen window, does 3 slow squats, holding the counter for balance, or even just marches in place for 60 seconds. After 6 months, his blood pressure dropped 20 points. Why does this work? Those tiny movements keep your blood flowing, lower inflammation, and remind your heart to stay nimble. Think of it like oiling a rusty hinge. Small, consistent efforts prevent big breakdowns. The hidden culprit: late-night snacking. Now, let's talk about a habit that seems harmless but is quietly stressing your heart. Eating late at night. My patient Joe, 72, loved his bedtime bowl of ice cream. "It helps me sleep," he insisted. But here's the problem. When you eat close to bedtime, your body diverts energy to digestion instead of repairing your heart and blood vessels. Plus, spikes in blood sugar while you sleep can damage artery walls over time. The fix? Finish dinner at least 3 hours before bed. If you're hungry, try a small handful of almonds or a cup of herbal tea with cinnamon. My wife Ruth swears by a warm mug of chamomile with a splash of oat milk. It's like a hug for your heart and your nerves. A surgeon's plea. Now, these first 2 habits, sitting too much and late-night eating, are just the tip of the iceberg, but they're the ones I see doing the most damage to seniors who otherwise take good care of themselves. Start today. Set that timer, move your body gently, and give your heart the nighttime rest it deserves. But we're not done yet. There's one more habit, something so common you'd never guess it's linked to heart disease. It's not smoking, it's not sugar, and it's something even I struggled to quit. But once you hear the science, you'll never look at your daily routine the same way. In my years of surgery, I've held countless hearts in my hands, some strong and resilient, others fragile and weary. And let me tell you, friends, the difference often comes down to choices we make every day. Choices so ordinary we don't realize they're chiseling away at our health. Today, we're tackling two more silent saboteurs, habits I've seen undo even the most careful seniors. Habit number 3, overusing over-the-counter painkillers. Let's start with a bottle like this. Holds up ibuprofen. Meet my patient Linda. At 70, she popped these pills daily for her arthritis. They're just Advil, she'd say. But after 6 months, she landed in my ER with chest pain. Turns out, these harmless pills were inflaming her arteries and spiking her blood pressure. Here's the hard truth. NSAIDs, like ibuprofen or naproxen, are not your friends if you're using them regularly. They trap sodium in your body, strain your kidneys, and thicken your blood. Over time, that's a recipe for heart attacks or strokes. Now, I'm not saying never use them, but if you're reaching for the bottle more than twice a week, it's time to pivot. Try topical creams with menthol for joint pain. Ask your doctor about acetaminophen. It's gentler on the heart. Or explore physical therapy. My own knees swear by swimming. It's like flying without gravity's grip. Habit number 4, the salt trap, a silent killer. Next up, this little villain shakes the salt shaker. My neighbor Frank, 76, loved his canned soups and frozen dinners. Easy on the teeth, he'd say. But his blood pressure, not so easy. By the time he collapsed shoveling snow, his arteries were 80% blocked. Here's what most folks miss. It's not the salt you sprinkle, it's the sodium hidden in processed foods. One can of soup can pack a day's worth of sodium, stiffening your arteries like dried-up rubber bands. But here's the fix. Shop the perimeter of the grocery store. Fresh veggies, lean meats, whole grains. When you do buy packaged foods, flip the label. Aim for less than 20% of your daily sodium per serving, and season with herbs, rosemary, thyme, or a squeeze of lemon. My wife makes a killer garlic and paprika roasted cauliflower that'll make you forget salt exists. A surgeon's confession. Now, I'll let you in on a secret. I used to salt everything, eggs, salad, even fruit. Bad habit from my residency days. But when my own blood pressure crept up, I had to relearn how to taste food. It took weeks. But now, a ripe tomato tastes like summer rain. These two habits, overusing painkillers and drowning in salt, are stealthy. They feel harmless until they're not. But small changes work. Start today. Swap one processed meal for a homemade stir-fry. Trade one pill for a warm compress. Your heart doesn't need perfection, just a few acts of kindness. But we're not done yet. There's one last habit I need to warn you about, one that's cost me more sleepless nights than any other. It's not in your kitchen or medicine cabinet, it's in your mind. And breaking it could be the key to unlocking a stronger, happier heart. We've talked about sitting too much, late-night snacks, painkillers, and hidden salt, all quiet saboteurs of your heart. But there's one last habit I need to address, and it's the most insidious of all because it lives not in your body, but in your mind. Friends, I'm talking about chronic stress and loneliness. Habit thrive, letting stress and isolation rule your days. Let me tell you about my patient, Rose. At 72, she'd survived a heart attack, quit salt, and walked daily. But she still felt a heaviness in her chest. "I'm doing everything right," she told me. Then one day, she mentioned she hadn't seen her grandchildren in months and spent hours worrying about bills. That's when it clicked. Stress and loneliness weren't just weighing on her spirit, they were strangling her heart. Here's the science. Chronic stress floods your body with cortisol, a hormone that inflames arteries and raises blood pressure. Loneliness? It's as deadly as smoking 15 cigarettes a day. Your heart thrives on connection and calm. Without them, even the healthiest habits can't fully protect you. The fix: small moments of joy and connection. Now, I'm not saying you need to become a Zen master or host dinner parties every night. Start small. My neighbor George, 78, adopted a rescue cat. "That little furball makes me laugh every day," he says. His blood pressure dropped, and his doctor cut his medication, or take my own ritual. Every morning I sit with my coffee and watch the birds for 5 minutes. No news, no phone, just stillness. It's like a mini vacation for my heart. Try it. Call an old friend, join a book club, or even talk to your plants. Laughter, love, and quiet moments of peace. These are your heart's best medicine. Bringing it all together, let's recap the 5 habits we've covered. Prolonged sitting, stand, stretch, move every 30 minutes, late night eating, finish meals 3 hours before bed. Overusing painkillers, opt for gentler pain relief. Excessive salt, shop fresh. Season creatively, stress and isolation, seek joy and connection daily. But here's the secret: you don't have to tackle them all at once. Pick one this week. Maybe swap canned soup for a homemade batch, or invite a neighbor over for tea. Your heart doesn't need grand gestures, just consistent acts of love. If you take nothing else from this series, remember this: your heart is more than a muscle. It's the rhythm of your life, the keeper of your stories. Treat it like you'd treat a dear friend, with patience, kindness, and a little adventure now and then. Before I go, I'd love to hear your story. Did you find a new hobby that eased your stress? Did swapping salt for herbs surprise your taste buds? Share it in the comments. Your journey might inspire someone else. And if this series moved you, do me a favor. Tap that like button. It helps others find this lifeline. If you're new here, hit subscribe. We're building a community of heart warriors, and I'd be honored to have you. Thank you for trusting me with your time. Remember, friends, every heartbeat is a chance to choose joy, to choose connection, to choose life. Here's to your strongest, happiest heart yet.